Hi there. So why should you go and see a chiropractor? Do I need a chiropractor? Why a chiropractor and not an osteopath or a physio? All really good questions. In this short video today, I'm going to try and answer all of those questions. So firstly, let's talk about sort of why a chiropractor, not a physio or an osteopath. Well, firstly, sort of chiropractors. As a chiropractor, I am one. My name is Dr. Sundar Sandhu, and I'm from Bedford Chiropractic Clinic. I've been a chiropractor now for over 26 years. The reason I became a chiropractor was because as a chiropractor, my knowledge base of human anatomy, physiology, the nervous system, how the body sort of works is basically sort of, I believe, more superior than a physio. And I'm not being derogatory in any way at all. It is just that I trained for 5 years to be a chiropractor, and I believe that my skill and my knowledge base is greater than, say, a National Health Service physio. For physios that are in private practice, you've gone on to do the extra training to do a master's, obviously they are very specialized and highly skilled. An osteopath is very similar to a chiropractor in the sense of the way that we work in certain cases. But an osteopath in the traditional way would be working much more on muscles and doing what we call long lever stretches, so stretching the body. Whereas a chiropractor will work primarily sort of on joints and on the nervous system. Now why? Well, because this is the most important part of you. The way this works is that you have your brain, and the brain sits here in your skull and comes into your body. And these 33 beautiful vertebrae are the house. They are where the spine and the nerves come out. And they are called, I call them, the way I describe them to my patients is that they are fuse boxes or switches, because they basically need to work functionally in a normal way for that nerve to work at its best. And it needs to work at its best because when it does, what you have is you have that, where 70% of the nerve is all about keeping you alive, 20% is about sort of getting your muscles to work for you, and only 10% is the pain bit. I'll come back to that in a minute. So as a chiropractor, if you have any kind of pain or discomfort, we need to look at this because we need to make sure that the nerve is working well, is firing to the muscles, because muscles are just pure pieces of meat. They are meat designed to move a bone backwards or forwards or to move a joint. That's what they're for. But they only work if the message from the nerve goes to them. So coming back to this, you have these 7 nerves that come out of the neck, the cervical spine. You have these 12 nerves that come out of the thoracics, where the ribs are. And you have these 5 that come out of the lumbar. Then you have the sacral nerves that come out. And the lumbar and the sum of the sacrums, the upper ones, form the sciatic nerve, whereas the ones from the neck form the brachial plexus running down to the fingers. Now, if that nerve is stopped, not working, the muscle is not going to work. This was regrettably proven by the accident that Christopher Reeve had, Superman. When he fell off his horse, what happened was he broke his C2, C3 here. So he fractured it. So he broke the spinal column. So none of these nerves here worked. And you had to have 7 machines that actually did all the work that these nerves do, because those nerves, they control the body. Everything that happens is controlled by them. The 7 here control all of these, right? So for example, the C1, right, controls the intracranial blood vessels. C3, the base of the skull, the neck muscles, the diaphragm, the breathing. Down here, the 12 ribs, for example, T6 controls the diaphragm and the stomach. Down here, the lumbar ones, for example, L3 controls the reproductive organs. So if this message from these nerves is shut off, is impinged, doesn't work as well, isn't working at 70%, is working maybe at 50%, then something isn't going to work. So as a chiropractor, what we do is we check all of this and we make sure that the full movement, range of movement, is there for your nerves to fire at its best. So basically we're checking these fuse boxes. And that is why chiropractic is important, not just for when you're in pain, but also as a maintenance checkup. So why should you go and see a chiropractor? Because you want to make sure that your nervous system is working well. Now, I, as a chiropractor, 26 years, I've learned many skills. So when you come to me, my sole purpose will be to find out why have you got the pain. And that will mean a full body examination, checking every single joint in your body, every muscle in your body, the strength of it, to make sure that the nervous system is working really well for you. And then by ensuring that it's working well for you, we can get you out of the pain, because pain's horrible. But we can also help the rest of your body, because as hopefully you can see from this, the nerves don't only control the muscles, they actually control your physiology, your organs as well. So by getting those nerves working well, we're going to be affecting other health areas as well, and that's got to be good for you. So you need to book in, come in for that initial consultation, let's do a health check and get 2023 off to the best health start for you. Give us a call today.